Another risk factor is travel to or live in certain areas. The risk of contracting TB is higher for people who live or travel to areas with high rates of TB and drug-resistant TB, including Africa, Eastern Europe, Asia, Russia, Latin America, and the Caribbean islands. Another risk factor is poverty and substance use. Lack of medical care. If your income is low or fixed, you live in a remote area, you may not have access to the medical care necessary to diagnose and treat tuberculosis. Substance abuse, intravenous drug use and alcohol abuse weaken your immune system and make you more vulnerable to tuberculosis. Tobacco use, the risk of contracting tuberculosis and dying from this disease greatly increases. Complications of tuberculosis. This active, untreated disease usually affects the lungs, but it can spread to other parts of the body through the bloodstream. Complications of tuberculosis include pain in the spine, back pain and stiffness are some of the common complications of tuberculosis. Joint damage. Tuberculous arthritis usually affects the hips and knees. Swelling of the membranes that line the brain. Meningitis. It can cause a constant or intermittent headache for weeks. Mental changes can also occur. Kidney or liver problems. The liver and kidneys help filter waste and impurities from the bloodstream. These functions are impaired if tuberculosis affects the liver or kidneys. Cardiac disorders. Tuberculosis can infect the tissues around the heart, causing inflammation and edema that can interfere with the heart's ability to pump properly. Tuberculosis prevention. Protect your family and friends. Stay at home. Do not go to work or school, or sleep in a room with other people during the first weeks of treatment for active tuberculosis. Ventilate the room. TB germs are most easily spread in small closed spaces where the air is still. Cover your mouth. Use a tissue to cover your mouth every time you laugh, sneeze, or cough. Wearing a surgical mask when you are with other people during the first 3 weeks of treatment can reduce the risk of transmission. Completely finish your prescribed medications. If you stop treatment early or skip doses, the TB bacteria have the potential to develop mutations that allow them to survive the more powerful TB drugs. Vaccines. In countries where tuberculosis is more common, babies are often vaccinated with the vaccine because it can prevent severe tuberculosis in infancy. There are dozens of new tuberculosis vaccines in various stages of development and testing.